Okay, hi everyone. I think we'll get started since we have a critical mass. We have a lot to cover today. Thank you so much for joining us. Just a couple of quick logistical notes before we actually begin the content. If you're having any trouble hearing us with audio or text, please email Stacy, who's right now doing an amazing job welcoming everybody in the chat. You can chat directly to her, or you can email her at stacey.strongaroni@vera.org. I see someone's already raised their hand. Stacy will be monitoring the chat, so if you have any issues, you can reach out to her. And throughout the briefing, we will ask you all to please submit any of your questions for the panelists in the Q&A box. We will spend the last 20-25 minutes today answering questions, and so throughout, as questions come to you, please write them in there. And if you have any comments during the presentation to say, oh, this is happening, actually, I've heard this, please put them into the chat box. We really want this to be the start of a dialogue among all of the people here. So thank you again for joining. Next slide, please. So today we're here to talk about what service providers are saying they need during COVID to support people who are leaving jail or who are formerly incarcerated. And as most of you know, thousands of people have been released from LA County Jail in efforts to keep it from becoming a vector of the virus across the county. But we still have thousands of people who are in the jail who can safely be released to the community, including some who would benefit from supportive services and some who really need supportive services in the community. And so community-based systems of care are going to be critical to how all of us survive, establish stability, and recover as LA County continues to try to decrease the population of the largest jail system in the country, and as the county begins to reopen. So today we're going to hear first from Carrie Gracia of Prototypes, the clinical manager there and a member of the LA County Reentry Health Advisory Collaborative. She's going to talk about how COVID has impacted her work. Then we'll have a panel to discuss some of the major themes from a recent survey of service providers on their needs. And then finally, we'll open it up around 5 p.m. to your questions. So if we could remove the slides, we'll have a conversation with Carrie. Carrie, can you just unmute yourself so we can make sure we can hear you?
Good afternoon, everyone. Can you hear me?
Yes. Thank you so much for being here, Carrie.
No problem. My pleasure.
I was hoping that maybe you could just start by introducing yourself, telling us a little bit about yourself and what your work was like pre-COVID and how COVID has changed your work, especially given the large number of releases from jail.
Hi, everyone. My name is Carrie Gracia. Like she said, I am the clinical manager of Prototypes Women's Center. It's a program of Health Right 360. I can share with you just a little bit of background on myself. My journey started here in 2010 as a therapist here. I was interning while I was in grad school. A year after that, they onboarded me as a full-time therapist with our reentry program. We have a very large reentry coalition. Many of our funding sources and referral processes come through the reentry process. I transitioned 18 months later to a federal grant, and I was the family navigator of that program. During that time, I was able to gain an understanding of the DCFS process, the referral sources for that. And then I transitioned to supervisor and then on to clinical manager. During pre-COVID, we ran various evidence-based practice groups. These EBPs, such as Seeking Safety, DBT, all groups varied from like 12 participants to 30 participants, all the way up to some of our therapeutic groups that can be included up to 60 participants. With COVID, immediate changes were needed. Simultaneously, not only did we have to downsize the amount of groups that we were providing, but we really had to think of how do we practice social distancing in a very large setting. Mind you, our residential facility here, we're licensed for about 164 bed facility, and we also have children that reside here with their mothers. This is all fully women-based. We do have outpatient next door. So while we're transitioning here to provide one-on-one services, we had to make changes at outpatient at the same time, right? So in the beginning of COVID, SAPC mandated that we can only do face-to-face contact, which were brief sessions. These brief sessions were about 15 minutes face-to-face and no more than that. We also during that time had to maintain social distancing. Soon after, it was shared that we can expand on that. we had to expand to no more than 9 participants in a group setting. So that 9 participant, you can understand, we went from face-to-face of a brief session to 4 participants and then expanded to 8 participants. Those multiple changes put a lot of strain on the agency itself, but it also put a strain on our clientele and what was necessary for them to be successful. You know, they're used to having those evidence-based practices, learning the coping skills that are necessary for them to be successful. Without those tools, we've seen a huge increase of clients eloping or AMing. AMing is also known as leaving against medical advice. And so we had to really think about how we can mainstream and provide the services necessary for them to be successful. And thankfully, just recently, we were able to expand on those services. So now we can have a group setting of 10 participants in a group, and we were basically able to expand on those evidence-based practices. And since then, we've seen an increase in retention. Simultaneously, as a clinical manager here, I also oversee the program operations at outpatient. Outpatient was a whole nother plethora of issues that came about. Many of our clients, they didn't have the capabilities to go via Zoom or telehealth, right? The agency itself had a model and a desire to do that, but it was more of maybe a 3-year plan, right? Basically, we had to throw that 3-year plan into just a couple weeks to make it happen. And so no longer were we providing face-to-face contact. We had to find a way to really provide the services necessary so they can be successful in a telehealth, telezoom, or telephone session. And that was very, very challenging in and of itself. Not only did we have to make sure that they were overcoming barriers of the phone, limited data, not having access to the Zoom capabilities, not having a space around them where they feel safe to really share in a group setting. You know, just a reminder, many of our clients, they live in cohabited situations. They may be in a sober living and they don't feel comfortable to be able to just talk openly in that specific space. So just plethora of issues and concerns that have developed that we're still trying to evolve and resolve in a timely manner.
Thanks for sharing that. And definitely some of the providers talked about the challenges of telehealth and even some resistance to it. I'm curious to, in terms of getting clients and the referrals, I think you had mentioned that maybe there was a decrease in referrals. Can you talk a little bit about what you feel like is driving that?
I think one of the main barriers in our decrease in our referrals comes from the relationships that we have developed over time. For example, here at our residential site, we've noticed a decrease in our census. Ideally, we're housed for 164 beds, and we were mainstreaming about 130 clients, give or take. That number has decreased tremendously. And so I think it's due to some of the results of the courts being closed. We also had SENS navigators that were assigned in each of the courts that were really, really instrumental in providing that referral process, right? But since they've been furloughed, we've lost that connection. And so we've had to develop systems to try and make it work just to keep us afloat.
And how are you, without the navigators, how are you all screening people to determine if they're appropriate for your program?
For our particular site, what we did was we created a mental health screening tool. And basically that is a brief assessment tool that we use to indicate if a client is going to meet medical necessity and be appropriate for our program. And so without having that SENS navigator or an individual that is assigned to our agency, it places a high risk for us because we're not really knowing how confident we are in that assessment tool without us being the one that's presenting it, right? And so we're taking a huge chance on allowing an individual inside the jails to complete this tool, not knowing if it's fully accurate, you know, not having the ability to ask or probe additional questions. It's a huge risk, but we're taking it because we know that there's such a need to provide these services to the individuals and to get them out of custody, you know, and give them an opportunity to get treatment.
Yeah, no, that makes a lot of sense, and having to adapt to that is not ideal, but it makes sense. Are you all not able to go into the jail and personally screen or do telescreening? Are any of those things available to you?
So in the past, we utilized some of our connections, right? We all have our services and our connections. And so we had a local entity that we would go in and present and be able to do a Zoom screening. And so the client would able to have a face-to-face contact via Zoom, and that we can complete that. But lately we haven't had access, and that's due to COVID, right? Many of the offices are fearful, right? Very well fearful of cross-contamination. You know, we're working in these residential settings that places us at risk, right? And so they're limiting our ability to go in, and not having the ability to go into the jails or these entities really, really places a strain on our ability, like I said, to make appropriate decisions to get these clients in.
Makes sense. I think that when we talked to you before, you had mentioned that the process has been more difficult as well with getting the sort of handoffs for people that are being released to go to your residential services who are coming out of jail. Can you talk a little bit about that?
One thing that we have noticed an increase in is occurring is some of the clients will go out and we'll pre-screen them and we'll find them eligible for our residential treatment facility. However, they're in that interim of going to their courts to get conditionally released for us to pick them up. During that waiting period, we're finding an increase of clients being released on their own accord. And then when we go to pick them up, they're no longer in custody, right? And so that places a huge issue, not only on the strain of the work that we're doing as an agency and the time that we're placing on these clients, but also the welfare of these individuals, right? If they're identified as having a need of residential treatment and they're out there, the likelihood of them relapsing, picking up another charge is so much more high, right? And so I think if they try to find a way to navigate and expedite that conditional release, it'll really help us mainstream to really gather the clients before they even get released. I'm not sure what's going to happen with the courts when they reopen, because
I was
many
just
of
about
them,
to ask, what do you think is
right?
going to happen on their court dates if you weren't able to pick them up and they were supposed to go to your residential treatment? Does anybody have any idea?
I would say that it's going to be a huge issue, because even if they were mandated to complete residential treatment, if they may not even meet medical necessity by the time that they get here. So I'm not sure what that's going to look like in the court eyes, but I'd be open to even seeing that.
Gotcha. I'm curious, as you think ahead to the future and as we're all trying to figure out in these coming months what COVID is going to do for our lives, for our work, in terms of the work of prototypes and your facility, how are you thinking about COVID and how it's going to impact that work?
I think, the county has done a phenomenal job in accessing emergency resources to providers, and we are tremendously thankful. My greatest fear is the upcoming fiscal year. My concern for the future is that the decreased funding of education is going to be it's going to be decreased tremendously. Right here at our residential facility, for example, we have an early Head Start program on the facility grounds. What that means is, while their moms are getting treatment, the children are getting the adequate necessary education so they can be successful. Many of those children come in with significant delays in their education or their developmental milestones, and we have seen just the ability over time that they're able to either meet the mark, exceed the mark, and just get to the level that they need to be. And so without that necessary support, I don't know what we're going to do.
Thanks for sharing that. I'm wondering, before we get into the different themes from the survey, and we'll come back to you on some of what you're seeing on some of these themes, but I'm curious on a broader level, what are you feeling like the community still needs right now from government and system actors for service providers to kind of maintain capacity?
Another thing I think we should really focus on is the ability to provide housing resources. Next door, we have the ability to provide recovery bridge housing. What that entails is an additional 90 days of free rent where a client can stay, because we've noticed the need to provide marginalized services in that gap, right? That transition from residential to outpatient treatment. And during that time, clients face tremendous barriers to really obtain employment, find that stability, be successful. And so having that additional 90 days has been really integral in their success of the program itself, right? During that time, they're given the intensive case manager, they're able to work on that, they're able to focus and maintain a stability with their mental health, their sobriety, and so much more. However, with COVID, it's really, really challenging. Many of our clients, they work at McDonald's, fast food restaurants, and we've seen a decrease in their hours that are being given, right? And so when they come up to that 90 stay where they have to transition out, they just don't have the resources or the funding necessary to really sustain on their own. And so we're having to extend those RBH services. So if I would say anything, more funding for our RBH services and long-term stable housing is necessary.
Yeah, thank you. That's actually a perfect transition into our first topic. So thank you very much. I'm wondering, Whitney, would you mind putting up the first slide? So as promised, thank you so much, Carrie, for that. It was really helpful to kind of ground us in the perspective of providers who are on the ground. Carrie is actually at her facility right now. And so we really appreciate you taking the time to join us. We are here as well to talk about a short survey that we completed a few weeks ago by over 50 service providers in LA. The survey questions were developed with the county's Reentry Health Advisory Collaborative, which Carrie is a part of, and one of our other speakers, Gilbert, is also a part of, people who are directly impacted and a lot of whom work at service providers. So we were very grateful for their expertise. We also got outreach support from Community Coalition, Frontline Wellness Network, and Los Angeles Regional Reentry Partnership, or LARP. And we have great panelists today from all those networks. We're also joined by Diana Zuniga from DHS, and she was also one of the staff leads of the ATI work group. And in case I missed it at the beginning, because I think I might have, my name is Michelle Paris. I'm a program manager at the Vera Institute in the LA office here. Next slide, please. So throughout the presentation, I'll be sharing some of the bits and pieces of the findings from the survey. Unfortunately, because of the very limited time, we're not going to be able to get to everything today. So there are really important topics that we won't be able to cover, but we're going to cover some of the big themes that came out of the survey. We did send an executive summary and an issue brief out to everyone who registered yesterday. So please check those out if you want to learn more about the issues that were flagged. Today, we want to discuss solutions and how to meet the needs of the providers, and we want this to be the start of the dialogue with you all as well. We got 53 responses to the survey. As you can see from this chart, all of the service planning areas were represented. We got the most responses from Metro LA, which is SPA 4, and South, which is SPA 6. And we had a pretty even division between small, mid-size, and large organizations. So we really did get a diversity of perspectives, and a lot of these themes that popped out were consistent across the board. Next slide, please. We started the survey in some ways by asking providers, what is it that you think formerly incarcerated people and people being released from jail need the most from your perspective as a service provider? And the number one answer, not surprisingly, as Carrie told us, is housing. 91% of survey respondents selected more equitable access to housing and beds in certain geographical areas. That was the highest response rate by far. 88% said access to short-term housing, including residential treatment, and 87% said access to long-term housing. There were also comments that noted that we need a wider range of housing options, including often overlooked populations like transgender people. And when asked about what organizations need to maintain capacity, like Carrie said, 75% said a pipeline to different types of housing for clients. So what is the long-term plan for people, even if we're able to find shorter-term solutions for them? So with that, I'd like to transition to hearing a little bit from our panelists. And I'd like to start with Mark Anthony. Mark Anthony, would you mind just briefly introducing yourself?
Yeah, definitely. Thanks, y'all. Really grateful to be on this panel with folks, to be in this conversation. Thank everyone who's attended today. Frontline Wellness Network is a network of healthcare providers who are addressing the public health crisis of incarceration and criminalization. Essentially looking at the health outcomes of being incarcerated, the health outcomes of high policing across neighborhoods, particularly in Black and brown neighborhoods, and really trying to shift resources away towards more dignity, towards more well-being, to really expand the well-being and life of our folks who traditionally are experiencing a lot of pressures from those systems. And I'm happy to answer the question. You want me to jump in on?
Oh yeah, so I can start you off. Thank you for that introduction. Thank you for being here. Really appreciate it, and thank you for the outreach support. I wanted to kind of jump off of what we were just talking about, which is, you know, we know that a lot of the short-term beds are coming online, and emergency beds, and yet this issue of housing is still named as a top issue. So I'm curious what you're hearing about housing needs, and maybe if you could react a little bit to what Carrie was saying about this need for people to transition from short to long term.
Certainly. And so our membership is made up of mostly clinicians and medical students, residents, clinical residents, who work in various spaces. So they work in organizations that provide services like, for example, a Project 180, or a smaller organization like a SoCal Club that is HIV support in South LA, or they work in the jails. And so there's various perspectives that our folks are coming from around this. But I think there's a unifying concern around how do we use this COVID-19 moment to build the infrastructure we need to really invest in the priorities that we've been talking about as a county. And I think overwhelmingly what we hear is a call for folks to think about alternatives to incarceration approach as a COVID-19 response, and really leaning on the things that we've approved prior to the COVID-19 state of emergency. I know that we've talked about the various needs of housing, and certainly I know that the Board of Supervisors cares deeply about this issue. And even this week, there's discussions around how do we think about this long-term housing question. And Phil Ansell in particular has spoken a lot about the need and the efforts to bring on 15,000 beds to house people. And a lot of that is looking at Project Roomkey, which is a critical moment. It's a critical opportunity that's utilizing hotels and motels and those things and like. But again, those are short-term responses. As we look at the long term, some of the conversation has looked at this question of looking at various types of housing that include various types of needs. And I know at the conversation on Tuesday, there was some, in my assessment, some inkling towards not everyone needs housing with services. And I believe that's true. Some people certainly need just a roof over their head. But if we're talking about incarcerated people, if we're talking about formerly incarcerated people, if we're talking about trying to challenge some of the dubious distinctions that we have in Los Angeles County, prior to COVID-19, the jail was the largest mental health provider in the country. In this moment, we've reduced the jail population by 5,000 people. We are still the largest mental health facility in this country, being our jail system that includes 4,500 people. And so I think when we think about the type of housing that's going to be necessary to support dealing with not just our houseless crisis, but our mental health crisis, it's going to have to look like permanent supportive housing. It's going to have to look like housing where people have very close access and close proximity to social workers. Some of the strategies that Carrie had named very much sound in line with a lot of what our providers are saying, who work in the jails, but also work in the community. I think, we are seeing a couple motions on the table right now that are moving, that are looking at how do we transition folks off of these Project Roomkey beds, both for folks who are over 65 and below 65, and shout out to the supervisors for moving on that. Again, we really want to make sure that there is an emphasis on the various types of services that are needed, and that there's not a defaulting to housing that doesn't include services, because that will not meet the stated commitment and promise that our county has made to continue to reduce the jail population. And I think we have the opportunity to invest in that in this moment. And that's what providers are really looking for, is how we use this opportunity to invest in those strategies.
Thanks, Mark Anthony. Troy, I want to go to you next. If you could just very briefly introduce yourself. Oh, you're muted. I'm sorry. If you can just unmute yourself.
I have to unmute myself to get to.
Yeah.
Troy Vaughn, I'm the Executive Director of the Los Angeles Regional Reentry Partnership, LARP, and we are a network of over 75 public and private partners who deal with issues related to people returning into our community. So we're really interested in looking at things from housing, employment, education, policy, legal, services, incorporating our faith community into the process, integrated health. We look at a full gamut of how we utilize credible messengers into the process of ensuring that when people are returning home, that they have the greatest level of access.
Thank you, Troy. I want to ask you a little bit, Mark Anthony mentioned room key, and based on the survey responses, we really had actually differing opinions on the short-term options and how well they were working. So we had heard that room key was starting to work pretty well. Some said that new shelter capacity is insufficient in volume and underutilized because there's confusion about how to access it, or there are restrictions. I'm curious, what do you feel like there needs to be transparency on, and why there might be some of this confusion and differing views?
Yeah, I think that Mark Anthony and Carrie just started to hit on a lot of different key factors, but here is the same old adage in terms of people who already have access really get the information, and so they view the interface with the access differently than those that don't, right? So when you are not able to get the information out in a way in terms of how to access and expand capacity to other service providers that can now benefit from the process, then what you have is a closed system to some, and then an open system to others. And when you do that, you get varying degrees of interpretations of how that is working. And I think that's why it's important that we begin to move toward where we started with alternatives to incarceration and creating a more robust coordinated care system that is really beginning to address this issue of diversity as in terms of housing and contracting with the county. We have a huge capacity issue, and I know we're going to get to that later in the conversation, but Project Room Key begins to expose again an issue that we don't really understand how we need to utilize or leverage existing resources. Let me give you a case in point. So when you talk about Project Room Key and you place people in housing, but then they don't have adequate services, and it's not just clinical services or medical services, but also those other supportive services that they need, food, laundry services. We see that they're starting to put that out, but it's later after the fact, right? It's not a consideration of how we put those services in place. And so we're left scrambling with how we actually begin to, implement these resources. And then we have other things that we know are working, like reentry intensive case management services, healthcare workers, other navigation systems that are in place that can now be interfacing, if we would put resources into those components, interfacing from a service delivery component while people that are in the houses or in these hotels can begin to transition with thoughts about how we get them out. And so right now, because that level of care coordination is not taking place, we're going to be at the end of it again, when everything is over, trying to scramble how people move from one thing to the next. So to me, that's what I think might be the difference in opinion.
Thank you, Troy. Gilbert, can I just come to you next? Would you mind just introducing yourself briefly, please?
Absolutely. Good day, everyone. My name is Gilbert Johnson with Community Coalition. I'm the lead justice organizer at COCO, which is a 30-year-old social justice organization focusing on building Black and Brown unity. We're a community-driven institution that transforms the social and economic conditions in South Central Los Angeles by building that mass-based institution to change, influence public policy.
Thank you. So I wanted to ask you about equitable distribution of housing. Obviously it was the top thing that people named, that service providers named as a need. So I'm curious, what does pushing for equity in housing look like right now in the middle of a pandemic? Why is that so critical right now?
Very good question. So at COCO, ever since our founding, we have always done work to really strengthen and build out the social safety net by demanding the equitable distribution of resources and dollars to communities that were the hardest hit by the failed war on drugs, the crack cocaine epidemic, and the crime control era. And so we're continuing to do that work to this day with the Justice Equity Alliance, which I have to shout out Advancement Project and LA Voice, who are really implementing a frame of equity to take dollars out of this system of mass incarceration and invest it into the communities with the highest needs, again, to transform those. social and economic conditions. And so the communities that have been the most historically marginalized, oppressed, suffer from disinvestment and disadvantage, those are the communities that have the highest need. And I mean, the graph you showed earlier highlighted that perfectly, right? South Central is where we focus the scope of
I haven't shown that yet. Let me actually pull that up now, Whitney, if you can.
Yeah, you showed a bar graph earlier in South.
Those were the responses, sorry, but I wanted to highlight this because I think it speaks to what you were saying about your work with Advancement Project. The Alternatives to Incarceration Work Group, this information is from there, and I think it highlights what you were saying, Gilbert. So in the context of the Alternatives to Incarceration Work Group, $1 Million Hood's arrest data, so they analyzed arrest data to identify the communities most impacted by incarceration, and then the Justice Equity Needs Index.
Yes.
Jenny tool from Advancement Project. And they similarly do an analysis of communities highly impacted by incarceration and lack of government investment in services. And so these were the communities that were named in the list that the Alternatives to Incarceration Work Group used to decide on community engagement workshops. But, I think for me, even in my own work, I'm reflecting on the fact that in the rush to get things done, in the rush to find solutions, sometimes that equity can be lost. The vision for equity can be lost. And we inadvertently sometimes perpetuate the lack of investment that has plagued communities in the past, just like what you were saying. So I think it's critical what you're talking about, that as we think about investment now, that the communities that are most in need are being considered.
Right, and especially now when we're seeing projected budget cuts, right, which we're really looking at that as an attack on poor and working class Black and brown communities. We feel like we absolutely should not be investing into more suppression tactics and law enforcement, but fitting the needs of the community, the already long-standing needs that we've had, but also addressing all of the folks that have come home, that have come home and across the state. We're hearing that there are very high needs. And so those dollars need to be invested equitably, and we do not need any more cuts to the social safety net.
Thank you, Gilbert. Next slide, please. So we're going to transition to our next theme, which is really about the referral and reentry process from jail. So I just here want to talk about a couple of the survey responses. So a number of people responded noting that people are falling through the cracks upon release from jail, just like Carrie mentioned, where folks were even mandated to do services. The services showed up to pick the person up and the person wasn't there. And then the referral intake and release processes needing to be reworked with community and providers to make them more effective. So one of the comments that was made throughout the survey was that telescreening is not consistently available across facilities. And when I say telescreening, I mean either telephone or video screening for appropriateness for services that doesn't involve having a staff member go into the jail physically and risk increased transmission of COVID. So telescreening is not available across facilities or to all providers. So in a follow-up conversation, someone noted phone screening is now available after a couple weeks, but it's not available at CRDS, the women's facility, and that people who are in quarantine or isolation, people can't actually screen those individuals. So just by being exposed to COVID within the jail, people are now losing out on opportunities to be released to services. It seems like, and to Troy's point, that there wasn't necessarily uniformity across providers on if they were able to do phone screening. So some people said, we can't do any phone screening. And I'm hearing from other providers that they can do phone screening. So there was definitely a lack of uniformity with respect to that. There was a split in responses when asked if referrals had increased or decreased. And I think we need to explore that a bit more. But among the folks for whom it had decreased, in some of the follow-up conversations, to Carrie's point, access to intake people was one piece, but also limited court operations was another. So judges who would normally refer people for programming are not running their calendars as often. And so people aren't getting the opportunity to do diversion as much as they might have been in the past and are not being evaluated as much. And then the last thing is really lack of testing as a huge issue that people name. So some folks said that people are having their release delayed instead of being tested and released to programming, even when they've been evaluated to need a lower level of care. And then, you know, providers, especially inpatient providers and families, are feeling uncomfortable at the risk of letting a loved one in who hasn't been tested and screened for COVID, obviously putting a greater risk of homelessness out there for folks who are being released from jail. So I wanted to push it to Troy and see, you know, what are some of the ways that you think the county could improve the referral and reentry process right now, knowing there are a lot of, you know, points at which there are issues, but what do you think are the most effective things that the county could do right now? You have to unmute.
Keep forgetting I'm not the moderator in this. I keep muting myself. So, you know, first of all, I just want to say that, you know, COVID hit everybody and it fractured the points of entry into the justice system that was normally in place. And so everybody was thrown off their axis in terms of how they would adjust in the midst of that. And that shook up a lot. But a lot of times when you have earthquakes, it exposes areas of weakness within the system. And so this is just one of those cases where maybe we need to start rethinking about where people are assessed at, right? I think assessment in the community makes sense, right? Like in a lot of situations, and we have tools in place right now where the county can lead that in very resistant ways. I keep coming back to, for this particular case, you know, RICMS. And I want to say that because for me, that component that's in the community right now needs to be expanded in a particular way, because it can be displaced throughout the county and create access points where engagement is now at the community level through community providers.
Sorry, what was the acronym that you used? Can you just
the Reentry Intensive Case Management Service component that is ran by the Office of Diverted Reentry out of their reentry side of the house. And I want to say that because I think that program that's in place right now, if it was properly resourced right now, it can be an avenue in which assessments are being done to help people begin to access various levels of services. So I think right now, because when we have such a chasm in the old system of how people access, this is the time to make the shift and develop a new system that is community-led and community-based, and we can do things differently. I don't think that we're going to go back to the norm. I think we're going to stay in a virtual space. I think that, and now that we're here, we need to start thinking about technology utilization and how do we shift the capital that is needed in the community, because it's easy to say, let's shift to the better utilization of county. But again, we have an equity issue because not everybody can make that shift. Not everybody can make their facility ready. Not everybody has the technology and the resources to purchase the technology. And so we need to start seeing some release of funding opportunity that invest in capital and infrastructure from a technology standpoint, and then develop out the robust system that I think is connected to more of the RCMS or the healthcare component. There is going to be some resources through whole person care. And so maybe we may want to talk about how, if that happens and we get more resources through the whole person care channel, then maybe that's an opportunity to expand out, you know, some of these components where system navigation can be better utilized.
Thanks, Troy. Mark Anthony, how about you? Are there any concrete things that you feel like are priorities for improving this process of identifying people who need services, screening them, and releasing them?
Yeah, certainly. I mean, I think it's worth noting that a lot of organizations on the ground are really fighting for, you know, folks in the jails to get tested and to be released. I think we've just recently heard that universal testing is going to happen in the jails, and that's not the product of some kind of benevolent wisdom. That had to be fought for, and I think that's a problem, right? That we are in a moment where, in contrast to universal testing, we have a sheriff who literally has gone on record saying that he is practicing herd immunity inside of the county jail system right now. And he believes it's an accomplishment to infect as many people as possible, such that less people will have the virus. I mean, I think that is absolutely absurd, and I think we should take that as a sign of where investment should go in the future, as folks are saying. And I think as everyone is lifted up. I think some of the models we need to look at and some of the things we need to look at in terms of what's not working. We know that pre-COVID, 34% of houseless people who have died in Los Angeles County, according to a study that was done by DPH, received some type of mental health service in Twin Towers Jail. And so from treatment in Twin Towers Jail to release to death, that track did not work, obviously, and we cannot go back to that. And only 7% of those folks, 7% of folks who have died after release from Los Angeles Jail received some type of SAPC service, even though they had a diagnosis. And so systems are failing our folks tremendously. They're not meeting the needs of our folks, as Gilbert had mentioned, where there's been historic divestments. And some of the things that I think we can look at are simple things like how are we activating people's Medi-Cal much earlier. There's a really, really important problem that's happening where folks' Medi-Cal is not being activated until they are released. And there's been a resistance from the Sheriff's Department to help facilitate people's Medi-Cal being activated. Some folks have requested, can we get people's Medi-Cal online 10 days before their release? So as soon as they're out, we can connect them to services right away. One of the things that I think is interesting that I think we should be tracking are what is called open ward releases. How many folks upon release are being taken to an emergency room? And folks are relying on a system where emergency Medi-Cal is kicked into gear versus just getting folks the health insurance that they need right away. I think that's going to be really, really critical and really, really important. And then the last thing I'll just name, sorry, I don't know if you want us to move.
No, that's okay. We're running a little short on time, but if you can go briefly.
No, go ahead. Go ahead. I can speak to this.
Okay. Just very briefly, Carrie, before we move on to the next topic, I know that you and I, when we had talked, you had mentioned the Medi-Cal issue as challenging, and I saw you nodding to Mark Anthony. Was there anything that you wanted to add with respect to that?
Just one thing, we are noticing a really, really hard challenge of really activating Medi-Cal within that 60 days. It's mandatory. So SAPC put a requirement that in order for us to be able to get funding for them, they need to have active Medi-Cal in the county of Los Angeles within 60 days. That has been a huge challenge, especially with the limitations of the providers really gaining access with that. In addition to that, we also have a significant amount of undocumented individuals that are trying to seek services. And so recently we were informed that those individuals don't adhere to that 60-day window to access those benefits. And so if an individual were to come and access services with our provider here, they would need to have MHLA services prior to the enrollment. And so I just want to really emphasize that addiction does not discriminate based on race, gender, and definitely not a nationality, you know what I mean? And so we need to do the same. And I think more emphasis on providing funding for undocumented individuals is really vital to their success.
Thanks, Carrie. So I just want to emphasize for 2 seconds, I think there was a brief point where the chat wasn't working, but definitely put questions into the Q&A box and any comments that you have into the chat. We're going to try to save time in 15 minutes or so to start answering any questions that you all have. So I want to turn briefly to capacity building and really thinking about that. So, community health workers and community-based organizations are doing so much to help people meet basic needs right now. So financial resources, food, identification, to help people survive at this point in terms of connection to all of these things and workforce development, treatment, things like that. And we see providers being very, creative, doing virtual support groups, coordinating free food shopping between organizations, responding to telehealth and shifting and adapting to needs there. Respondents mentioned wanting coordination between providers and more of that, which had proven effective where it exists, but there isn't a clear space for that. Needing more communication with government. So for example, finding representatives to troubleshoot on benefits issues, figuring out how to have a longer term supply of personal protective equipment for their facilities, and figuring out best practices in light of COVID. But again, there hasn't been a sort of natural space or clearinghouse for that kind of information exchange. And then, needing up-to-date information on service availability, both for community and for providers, but for community, getting it into the right hands, which right now is not exactly happening. So I wanted to briefly ask Gilbert, you all, I believe, did a survey of smaller providers. So I'm curious, what are the needs that you're seeing with smaller providers, and why is it so important to invest in those types of providers during COVID?
Absolutely. And so, I mentioned earlier about the safety net, and a lot of that work has been led through our prevention network at Community Coalition, which works with those smaller mom and pop service providers, specifically across South Central Los Angeles. And so we did disseminate a survey about over the last 3 to 4 weeks, and we're engaging providers in 3 sectors. So the survey can be broken down into 3 sectors, which is it focuses on justice reform, prevention, and treatment to really reimagine and redefine the social safety net in the current context. And so the top services that many of those service providers highlighted was, as far as specific needs go, and that they provide are mental health, reentry services, substance abuse, misuse, and treatment and housing. And so a lot of the service providers that we have engaged throughout SPA 6 or Service Planning Area 6, those are the services that they provide. We engage them around like the top 5 social determinants of health, and folks talked about income and social status, education and literacy, physical environment, access to health services, and employment and working conditions. And so the first phase is just a survey. We're also following up and doing more thorough one-on-ones with folks to get the qualitative and to get the quantitative and the qualitative data. And so those are some of the current strategies that we are using to really uplift the voices of those smaller providers that many are really on the verge of like their doors being closed. So again, that's why equitable distribution of services, dollars, and resources are so crucial, so critical right now.
Thank you, Gilbert. So last big topic, as we're shifting towards more organizational needs and capacity building, is funding, and leaving the best for last here. When asked about what their organizations would need from system actors to maintain capacity, 74% of respondents selected funding, particularly because of increased costs due to COVID. And these are some of the costs on the slide that you'll see that folks mentioned: providing personal protective equipment to staff and to, if they have residents, for example, or clients, hazard pay for staff, increased use of overtime, particularly with people calling out sick, added technology for work from home capabilities for staff. And, Troy alluded to this a little bit, that some providers don't have the capacity necessarily to even get that technology up and running, 80 hours of sick leave, and then increased benefits costs, particularly because of sort of upfront usage at this point during COVID. And so, some of the folks who responded mentioned that agencies like DMH had actually provided some flexibility in funding and the ability to shift programming and resources to respond to community needs, and that has been really helpful to pivoting. And so there was really a request by multiple respondents for unrestricted flexible funding at this point, given all these different costs that organizations are having to cover. So I wanted to go through each of our panelists and just talk briefly. I'll start with you, Troy. What are you seeing as the specific funding needs for providers to maintain capacity in the coming months, especially knowing there have been a lot of releases from jail. There are still people who can be released. We have a lot of folks in the community who still need services. How are organizations going to handle this in the coming months? What's needed? You have to unmute.
I think I would learn that by now.
Okay.
We got you. Yeah, I said that's a loaded question, but because there's a lot of needs in terms of funding. But for organizations right now, they need to know how they're going to survive in this particular environment. There's a lot of costs that we are having to absorb especially smaller organizations. I think there's some things that the county can do in terms of just not giving more funding, but really increasing dollars toward their admin costs, giving more dollars toward food costs, more capital costs that's related to helping them get their facilities in order, right? Like maybe there can be some resources that the county absorbs as it relates to being able to post the signs in the houses and help with space distancing and so forth in that, because that's a considerable capital cost. These are kind of like the low-hanging fruit for me. Relaxing insurance requirements to some degree, helping to coordinate pooled insurances opportunity right now, I think is going to be extremely valuable for organizations, because people are taking leave and having to continue to pay for staff and then you know, backfill these positions to services can keep going. What does that look like? Allowing organizations to be more creative in terms of how they space out their staff configurations, in terms of the utilization of staff, maybe one on, one off for a week, and really creating these different opportunities for staff so they can be more flexible in their budget spending across multiple opportunities. We're going to be able to have to look at resources that are coming into our community, because they're going to be reduced considerably. We don't know what's going to happen in the third quarter. We don't know what's happening. A lot of our revenue comes from tax revenue. Everybody knows that. We're going to have to be really creative about what larger organizations receiving contracting, putting in those contracting requirements for them to contract with the smaller organizations to provide some level of services that not necessarily the larger organizations need to provide, so that we can make sure the safety net is spread and far out as wide as possible. So there's a lot of things that we could do here locally in terms of a funding piece. And so I'll just leave it there so we can, for time.
Thanks, Troy. Gilbert, I want to go to you next. You know, do you want to tell us a little bit about the specific funding needs for providers to maintain capacity, especially knowing that we're in the middle of various like levels of government doing budgeting at this point?
Exactly. I mean, I think Troy hit it on the nail, but there's many parallels from what we're seeing across LA County, what service providers are saying and what folks are saying in high-need community like South LA. So we kind of grouped each of the responses of top agency needs into like 3 broad bucket areas, and one just being flat out access to funding. Right. And the second one being capacity building and being able to expand their staff and get more support with staff. And then guidance from county officials. Some of the providers said that they would like more communications on how to access more funding from, you know, ODR, you know, Troy mentioned RICMS. And another thing that we're seeing that's pretty interesting right now, because there have been so many, you know, racial disparities elevated right now, is that a lot of the service providers in SPA 6, and this is a strategy that we would like to spread across LA County, they are interested in using organizing and building grassroots community power as a method and a strategy to win and secure funding, to more funding for the programs. And so be on the lookout for that, everyone. But those are kind of the top 3 bucket areas that we identified.
Thank you, Gilbert. Carrie, briefly, do you want to mention any specific funding needs that you're seeing for providers to maintain capacity?
Sure, I can just share a little bit. I think ditto what Troy and Gilbert had to say. The county, like I said, has done a phenomenal job in really providing emergency funds when requested, and we are tremendously grateful for that additional support. I'm more concerned about the needs of the next fiscal year in terms and in reference to our ongoing budget. I foresee severe shortfalls and anticipate some of the ancillary non-DMC funds being dropped, especially when referencing funding for housing and prevention services. Just know that those services are vital in ensuring the success of those that we serve. Without these additional components, I don't believe that we, as well as other providers, can be as successful as we truly can be.
Thank you, Carrie. Mark Anthony, how about you? What are you seeing as the specific funding needs for providers to maintain capacity in the coming months?
Certainly. I mean, I think what everyone has named is really critical. And what I would offer is just more of a big picture conversation that I think we're all already in, But Troy had named that so much of this funding comes from sales tax. That's both local sales tax like Measure H, that's realignment sales tax. There's plenty of sales tax that we are not going to see and that we're going to see a deficit on for the next couple of years. And departments across the county board are taking hits around that. And as we see economy open up over the next couple of years, I think a question raises, how are we going to distribute funds based on the wisdom we have right now about what works, right? And so if we see that we have a sheriff, once again, who would rather practice herd immunity with our folks and put our folks at risk, while at the same moment we have providers who would rather take people in, who want folks to be tested, who want to reunify people with their families, who are willing and down to do that. I think that speaks to how we should be ramping up budgets once those sales tax dollars come back in and who should not be receiving those funds. I think we should also look at the key data that folks have laid out at $1 Million Hoods. If you look at policing budgets over the last several years in areas where there's major Black communities such as Long Beach, Lancaster, Compton, you see particularly over $200 million spent by the Sheriff's Department incarcerating and arresting people specifically in those areas, Lancaster, Palmdale, Compton, and Long Beach. Those are areas that have at least 30% Black communities. A lot of those arrests are misdemeanors, a lot of those arrests are substance use related, a lot of those arrests are crisis related. And so again, as we're thinking about the next steps and how we start to redistribute funds, we should distribute them where they work and where they work to solve the public health issues and the public health crises that we all really care about. And a lot of that is rooted in the providers that Troy is talking about. A lot of that is very much rooted in the providers that Gilbert is organizing. A lot of that is rooted in the providers such as Carrie and some of the providers that are in our network who really want to throw down for the future of our folks.
Thanks, Mark Anthony. So now I want to transition very briefly. Please send in your questions. We're just going to have one more segment for the next 5 minutes or so, and then we'll transition to Q&A. Please feel free to put things in the chat as well if you have additional comments. But I want to turn to Diana, who, as I mentioned earlier, works at DHS, but is was one of the staff leads for the Alternatives to Incarceration Work Group, which published a report in March, sort of right as as COVID was hitting us. The report came out, and you know, in the documents that we distributed to all of those who registered, you'll note that there are a lot of references to the ATI recommendations, and that's because a lot of the needs that were identified are the same as pre-COVID, and a number of them are sort of COVID related. You know, COVID has only exacerbated some of the issues that providers are facing that could be addressed by the recommendations that were in that report. So I wanted to ask you, you know, how do you see the ATI report being useful to the county right now as a roadmap to address the needs named today? And if you feel like there are specific recommendations that really speak to some of what you heard today or some of what you learned from the survey, please let me know.
Great. Thank you, Michelle. Thanks for being a wonderful moderator. And thanks to all the panelists. You all are just amazing and appreciate all the work that you're doing. Yeah. Thanks to the participants too. So, I mean, I would say, you know, one of the key spaces that we created was the ability to elevate the work that many of the panelists are already doing at the intersection of health and criminal justice through the ATI process. Really, the roadmap allowed us to bring departments and community members together to really engage in a coordinated and collaborative approach to develop an alternative vision, which really focused on preventing incarceration, improving care coordination, which has come up many times in this conversation, really focused on supporting a decentralized system of care that speaks to this equitable distribution of resources that keeps on coming up, and also to really hone in on building this infrastructure that's necessary to continue to commit to a care first and jails last approach. I would also say, as we experience this pandemic in so many different ways, that one of the key things that needs to be at the heart of the conversation which the panelists brought up and was a key value in the ATI was racial equity practices. And at this point, we really need to think about any sort of short fixes that we've actually been able to generate as a county and community. Having a real clear racial equity analysis around those pieces is key in understanding how we're going to sustain those pieces, but also how we're going to generate long-term solutions. Because we did generate some form of creative infrastructure because of this pandemic, and we have the opportunity to really think about how that's impacting Black and Brown communities that are strongly impacted by COVID and are the same communities that were impacted by incarceration pre-COVID. So I think being able to really reconvene this space, which I think we're doing right now, allows for us to elevate those pieces and allows for us to have these really intentional dialogues where we're sharing information and actually generating clear long-term approaches. Throughout the kind of brief that you provided, Michelle, and the summary, folks will see that there's several different connections to ATI recommendations because they're still kind of the same asks and the same needs that people that are impacted by incarceration and service providers have. One example of this was lifted up already around the short-term and long-term housing needs. There were a few recommendations in the ATI report, specifically recommendation 20, that spoke to the need for a diversity of housing opportunities for people with mental health, substance use, and other identifying factors. So this was something that was needed pre-COVID and has only been expanded because of what has been happening with the number of releases that we've had. Although, you know, we hear kind of varying kind of opinions about Project Roomkey, it is a clear kind of solution that has been proposed in this short-term issue that we're experiencing. I think when we think about that particular project, we also have to analyze it through a racial equity lens and ensure that Black and Brown people are actually getting the access needed for Project Roomkey specifically. I think when it comes to capacity building and flexible funding, this was a key component of the infrastructure section within the ATI report. We saw that specifically around capacity building, we talked about elevating the needs of small service providers, which comes up in Coco's survey and comes up in the work that LARP prototypes and Mark Anthony are doing as well. This is a huge piece where we as ATI thought about leveraging the existing county capacity building programs. And I think we have the opportunity right now to really figure out how to leverage those in a positive direction and continue to provide some sort of flexibility in those programs so that we can ensure the sustainability of organizations that are providing services right now on the ground, like RICMS providers that are equitably distributed across the county and could be expanded in an even more increased equity framework. This would also clearly help providers with the health and development of staff. Everybody is feeling the traumatic effects of the pandemic right now. And if we had capacity building resources and flexible funding, we could really answer the needs of providers that are on the ground, that are working in the jail, that actually need to support with what's happening. And then I would also just kind of lift up that we talked about this again and again, the centralized place for information. You'll see this a lot in kind of Intercept Zero and infrastructure within the ATI roadmap. But what I really think are the core components of that is that reconvening the ATI space and prioritizing kind of a public-facing service access tool that kind of currently exists in different department platforms right now would be key in allowing us to really elevate the resources that are available and do this kind of coordination of care that people are talking about because that the panelists are talking about, because there's clear gaps in the way that SENS or court linkage or community-based providers or referrals in the jail are functioning right now. So really being able to have this platform through ATI and through this interface, I think would be helpful and was a clear recommendation in the ATI. Again, I feel like we have the opportunity to really address the equity issues that have been lifted up for a while, and to utilize the preliminary implementation plans that the ATI created to start having discussions around how we can improve what has happened so far to really generate some clear long-term fixes.
Thank you, Diana. I appreciate that. So now we're going to turn for the last 20 minutes or so to any questions. So Stacy, my wonderful colleague, is going to help us pick out some questions. Stacy, do you have a question for us?
Sure. Let's see, the first question came up at the beginning when we were talking about housing. We touched on this a little bit, but about Project Roomkey. Tiffany Duvernay Smith asked, how successful is Project Roomkey at housing formerly incarcerated people?
I'll open this up to the group because I don't personally know the answer, but do any of you have any sense of that?
I mean, Project Roomkey on its face is designed to provide housing for people who've been homeless and from various different degrees. And so I just think it presents an opportunity to expand upon that concept. I mean, this is nothing new. We see it happening in New York, where people, all the resources in terms of housing and using hotels and being able to stipend. The question that I have, how are we going to continue once the FEMA money goes away? Is that something that we want to continue? 75% of that housing is provided through FEMA. And so right now we're in an emergency situation. And so we know that we can see the value in it, and we're moving people off of the streets and people that have been in chronic homelessness and coming from various entry points into the system. You know, I just want to have conversations now and not later about how we continue that and what resources are we going to be able to utilize in order to continue that. We see that we have a lot of different resources that come into our community that could potentially be utilized to continue to not only expand, but build upon that. But we have to stay woke, because a lot of our funding that is coming through some of the reforms that we did from Prop 47, and that's under attack right now through the prison spending initiative that's going to be on the ballot in November. And if we're not going to stay woke and all these reforms that we've done, and even though we see in the May revised SB 678 being jeopardized, and that funding under rights through probation and under rights partnerships with ODR and how we use that money coming to our community, Prop 57, attacking how what's happening with people while they're inside of custody and how they begin to access resources from that vantage point. And my fear is that we've been distracted on so many other areas and so many other lenses that we're not staying woke. And then when it comes time to election, a lot of the things that we have in place right now are going to be eroded away, and we're not going to really be able to understand why it happened to us once again, because we're not going to be there. But Project Roomkey on its face is great. We just got to find a way to keep funding it.
Does anybody else have a specific answer about how successful it is at housing formerly incarcerated people? If not, we can move to the next question. Sounds like no.
I mean,
I do think
that just
oh, sorry,
that
go
goes
ahead,
back to my comment of the need to continue to assess whatever short-term solutions we are currently engaged in, whether it's through how many people are getting placed, what is the racial breakdown of folks getting placed, and what are the intersectional data points that would allow us to understand whether or not these kind of projects are impacting the population that we would want it to impact.
Yeah, thank you, Diana. I was going to mention that one of the things that folks mentioned in the survey was the sort of transparency around the distribution of resources, around how things are being utilized for people who are coming out of jail and who are formerly incarcerated. And I think there's a lot of room there to make sure that we're all working from the same information and knowing the success and how to access all of these resources that folks are coming online. Stacey, do you have another question?
And if I could just add to that really quick, I mean, I think, you know, I just want to co-sign what's been said around the need to assess. So, I mean, the Office of Diversion and Reentry and some other folks at UCLA put out a report recently that was showing that the people who are in the jail context, who are with mental health conditions, who are the least likely to be diverted and the least likely to be treated and the least likely to receive services are Black people. And that's based on historic issues. It's based on systemic issues that have been named here. And in that report, they suggest even saying that we should focus on Black people in our diversion efforts because the disparity is so high in the county jail system. And so, I think we have grounds to move forward and being very specific and very explicit about our targets and about, who we need to get free and who we need to get served.
Thank you, Mark Anthony. So it looks like we have about 15 minutes left and maybe 4 to 5 questions. So we'll try to be quick in our responses now. Stacy, do you want to give us the next one?
Sure, great. Yeah, the next question came in about NAMI, basically asking how can NAMI partner with organizations that have access to incarcerated individuals? I'm talking about experiences of several arrests of people with apparent serious mental illness, and there were family members trying to obtain services but kind of not able to connect properly. And also flagging the Antelope Valley as a primary area of need. So I guess the primary question here is how can NAMI affiliates partner with people who are working with people with serious mental illness, and just kind of naming challenges in the Antelope Valley, which has come up in a couple of different questions and comments today.
Diana, you look like you want to answer this one. I don't know, you're nodding along.
I can try.
Yeah.
I mean, I am happy to chat with NAMI about what kinds of ways that we can collaborate. I do think that, I will lift up a program that DHS has been working on for a long time, Care Transitions, which allows for, and I'm assuming when we're talking about this collaboration, it's for folks that are inside of the jail. I think that's what I heard. So to me, Care Transitions is a program that really allows for an individual to be connected to a medical caseworker inside of the jail, and allows for some form of information sharing to happen for that particular individual's mental and health needs at the point of incarceration. So I'm happy to chat with NAMI a little bit more about how that works and how we can collaborate it together, especially in engaging family members that may have folks inside of the jail.
And let me just share that, Community Coalition is not a direct service provider, but I know that NAMI was one of the organizations that worked in the prevention network when Congressmember Karen Bass, now Congressmember Karen Bass was still the executive director, president, and CEO of Community Coalition. And so I mentioned that we're revamping the prevention network to really organize and galvanize the power of the people and the folks on the ground, the smaller, mom and pop folks. And so next month, we're going to start having meetings where we're convening service providers, and we're talking about strategies. We're talking about what's coming down the pipeline from the federal government to the state to the local. And so that's one way that we see collaborative opportunities with NAMI and other service providers, specifically in South Los Angeles, but again, we will be expanding across the county.
Thanks, Gilbert. I want to move to the next question, but I do want to note that, Diana and I have had numerous conversations about supporting loved ones with people who have loved ones inside the jail who have serious mental illness. And I do think there's a lot of opportunity there to increase transparency, to increase communication between loved ones and those inside, to help understand the systems, to understand how to build relationships with public defenders, to understand how to deal with the courts in the time of COVID and how are court dates happening. There's so much confusion as loved ones are on the outside trying to figure out what's happening with their loved ones inside. People are hearing their loved ones are in quarantine, can't call them, can't communicate. They're having trouble getting in touch and figuring out what's happening with court dates. How do they support their loved ones in front of the court? And so there's a lot of things in terms of connections to different pieces of the system that I think NAMI can be helpful with in terms of empowering loved ones to understand the system and to get information about what's happening. Stacy, do you want to go to the
Great.
next question?
Yeah, absolutely. So this was the tail end of Jean's question and also Ken's question. Traditionally, the Antelope Valley tends to be underserved. How are emergency programs working to get services up there moving?
Thanks, Stacy. Does anybody have any information there?
That was specifically for the Antelope Valley.
Yeah.
Yes, ma'am.
You know, this goes back again to the equitable distribution of resources. We know that the Antelope Valley has needed additional resources for a long time. I see Janie from Paving the Way Foundation on this call right now, who has been amazing in providing services for people that are justice impacted. Some of what ATI is finishing up is a second round of community engagement with the same organizations that did the first round of community engagement. So Janie from Paving the Way Foundation and folks from Ascent will be having a workshop really focused on ATI and reentry, specifically highlighting what's happening in Lancaster. So we'll be sure to share that information with you all so that we can have kind of this Lancaster dialogue in that space.
Yeah, and also prior to COVID, we were LARP was partnering with a lot of the justice partners, including probation, ODR, parole, all the community-based organizations in various communities across the county. And Antelope Valley was one of those. And Jamie is part of our steering committee at LARP and anchors what we were in the process of doing in that particular community with the community advisory committees. And so now we're in the process of trying to revamp that in the virtual space to get that conversation going to ensure that there's advocacy. The challenge that we have is in making sure that we have advocacy at every level. And then how do we raise up voices of people that are coming home into the system and give them a platform so that we can have real balanced communication as it relates to why we need services and then advocate. I think Gilbert had talked about using the organizing model to really begin to move the needle so that we have shared balance across. And I think one of the things that LARP is going to be doing through, we received a grant through the state in terms of utilizing people with lived experience, credible messages on the platform to create this advocacy voice across the county and empower them with the tools that they can now take into various communities so that we can really raise that voice up. So when opportunities like this happen going forward, that voice is not left in the back burner trying to figure out where they belong, but we know where they belong at the front end.
Thanks, Troy. So we have a little bit less than 10 minutes, and I think we have either 2 or 3 questions. So Stacy, do you want to give us the next one?
Sure thing. Next question is from Eunices Hernandez. What are service providers doing to move money away from incarceration and into community-based services?
Thanks, Stacy. Does anybody want to take that? I think we have just a couple minutes for that one.
I mean, that definitely speaks to the need for advocacy, more advocacy. I know during the ATI process, many of those mom and pop service providers that we talked about were not able to attend those meetings as much as they would have liked to. There's many factors from the times of the meetings to, you know, the location of the meetings and not having the capacity, again, to participate as much as they would like to. But the community engagement process that Diana mentioned that's going to roll out, I believe, July to August or June to August, that is a key way that you can get involved, answer questions, those, you know, tough questions, and focus on the organizing. And so please stay in tune with that. And that's, you know, Coco will be leading the one in South LA, but in each of those high need communities that was listed out, there will be an organization working with folks on the ground to hear what the needs are, to hear how we can access funding, so on and so forth. And so the next phase of the Alternative to Incarceration community engagement work will be a key opportunity for folks to weigh in.
Yeah, and for me, that's a legislative, that answer is better than the change in the legislation. A lot of funding that comes into our community is through legislative mandates. And so it's hard to say we want to wrestle it away from those historical institutions that have access to the funding, because that's where the funding starts. And until we're having a conversation about changing legislation, and so I'll give you a clear example, much like Prop 64, when that legislation was co-written and co-authored by one of our executive minimums lead linemen, she was intentional about creating capacity that funding would go directly to communities out of that resource. So as that money grew, there was a built-in component legislatively that money would go directly from the funding arm at the state level right into community. We don't have that historically through our fundings that are really already in our community. They have to go through justice partners to access that money. But what we've done at the local level is really create a real sense of collaboration and advocacy. So we have more now community-based organizations being contracted and utilizing that money. We have to continue that road, but that's the process that's in front of us right now. We have to know that first, and then we start having a legislative conversation about if we want to really make change and long-term change, it has to be balanced with understanding where it starts from.
Yeah, and I would just add that, I think this is that moment, right? I mean, again, I think this is that moment where a lot of that rigidity that we've seen around funding streams is being made really clear for folks. And certainly a lot of providers in our network are like, okay, how do we change that? How do we change it so that funding does go directly to providers and doesn't necessarily have to go to the sheriff or go through probation, but how do we actually have these sources going directly to the community-based organizations? And certainly that's a concern. And again, I think, one of those things we need to look at is things like AB 109, right? AB 109 funding, a lot of that realignment, sales tax funding, we're taking a hit right now. As it comes back up, how do we wrestle it away? And then what are the other legislative targets that are going to wrestle those things away? And I think the folks who are most in alignment with the mission and the work and the vision that LA County has laid out, a lot of the service providers on the ground. And I think we need to really listen to that and stay focused on that.
Thanks, everyone. So I just want to recognize we only have a few more minutes left. And I want to note from my end that, we're hoping that this is really the start of conversations. I know we are all short on time. We're super busy. Budgeting is happening. Things are moving. But we really hope that this sparks more ideas and solutions that involve government and county and city being in communication with community providers. And we know that there are a number of questions that remain. But we would love to hear from you all, in follow-up. If you have any questions or comments, you can email me. And I'd like to just give our panelists an opportunity to maybe make one, last comment if they want to say anything to our audience. So maybe we'll start with Carrie. We haven't heard from you in a minute, but if you want to make just a last comment about, moving forward, what would you like the audience to know?
I just want to take the opportunity to just thank everyone for just hearing our voices and giving us the platform necessary to just voice our concerns to meet the immediate needs of the clients that we serve. And just thank you again for this opportunity, right? I think we need to place more emphasis on housing, funding, just the fiscal year that's upcoming, which is crucial and vital to the success of many of our organizations that many of us serve.
Thank you, Carrie. Diana, do you want to have a last comment?
I think I just want to emphasize that, the work that ATI did was really from the lens of racial equity, equitable distribution of resources, bringing people together to coordinate and collaborate. And I think we were able to do that today on this call, in this webinar. And I hope that we'll be able to continue to do that in the future for people that are highly impacted by incarceration in these particular communities across LA County, specifically Black and Brown people.
Thank you, Diana. Gilbert?
Sure. Just, I'll just share, like, the system is not going to fix itself. Right? Transformation, transforming and tearing down and dismantling white supremacy, white capitalism. It's not going to happen magically, right? It has to come through us. And so as an organizer, that community-driven element and racial equity has to be at the core of everything. And one thing I've learned in this work is that when we look, a lot of people like to look at risk factors, but you know, a risk is just really an unmet need in many different ways. And so when we are meeting the needs of, again, of the most disadvantaged communities, we will see liberation, we will see freedom, and we will see thriving communities and elevation of our community. So I'll just leave you with that.
Thank you, Gilbert. Troy?
Yeah, I think that what I want to say to all the panelists is that we just have to respect every lens that is brought to the table. I think it's important that we understand that if we're going to move the needle, that we need the full participation of the entire community to actually move the needle and get this done. And I think there's more with us than against us in terms of the movement, but we have to take care on how we build and how we approach, and understanding that everybody on this call today approaches it from a different lens. And there's always collateral consequences that we may not understand when we impact one system. And so having as many people at the table that operate from multiple lenses as possible is going to be critical for us in the future. And then we have to show what collaboration looks like from the community standpoint, and lay all the differences down and get it done.
Thank you, Troy. Mark Anthony, last one. 2 more minutes left.
Yeah, for sure. I mean, I think, you know, I think the thing that really sits with me right now is just the notion that an alternative to incarceration response is a COVID-19 response. The very infrastructure that we need to respond to this emergency, we have laid out, we've spent the last year laying out, and I think that we can lean into that in this moment. And so I would just encourage us to stay on that course and keep pushing in that direction.
Thank you. Thanks, Mark Anthony. Thank you all. Thank you, panelists. You're amazing. Thank you for the work that you're doing. Thank you to all of our participants, and please stay in touch. All right. Take care, everyone.